Welcome back. We are now here with Ava Tutic, and she is the patient coordinator for Dr. G's Plastic Surgery in San Diego. Welcome, Ava.
Hi, Sheila. Thanks for having me.
Oh, I'm so glad you're here. We have some great things to talk about, and this is an approach that we really haven't discussed in a lot of detail yet on our show, so I'm so excited to get to talk with you about it. So, Ava, share with the viewers, what is your background that brought you to this point where you knew you wanted to be a patient coordinator by helping women and men get through the process of their surgery?
I have actually been in the global management area, strategic initiatives, typically, around mergers and acquisitions in Europe primarily. And one of the things that I had to actually do in my job is bring people together in different cultural areas and create a change management type of culture within these different countries. Because as you know, you can't just change different things and just expect different cultures to just accept it just because we can accept it. So part of my job was actually to go out and deal with people and bring them on board, have them feel comfortable about the change and, create that safety that they would need within their culture to move some of that change forward and accept it.
So share with also the viewers about your personal story regarding your surgery.
Well, my surgery, I have to tell you, took me a lot of time before I decided to do it. And it's a lot of what a lot of the patients actually feel too is the judgment that you will get if you do have plastic surgery. Coming from a strict European background and let's add on Roman Catholic religion onto that. That was definitely not something that would have been approved by God. So I actually put it off for quite a long time, even though I knew that that was something I wanted to do. And not necessarily for the cosmetic purpose, but more to look proportion with what I was. I'm a big boned girl. I was a -A cup size. I mean, Victoria's Secret turned me away because they didn't have those size of bras. So it wasn't good. I didn't feel very comfortable. I couldn't wear the beautiful gowns and really, feel good about myself. Right. So, like most women do, after my divorce, I decided, I've had my kids. Right. I think it's about time now that I take care of myself and forget about, judgments and caring about what other people think.
Time for you.
It's time for me.
I do understand.
So I went ahead and booked my consultation, had my surgery, and couldn't be happier.
Oh, that's great. That's great. Let's talk about your role as a patient coordinator. And what role do you play in your boutique practice that may be different from other practices that may either not have a patient coordinator or they may have multiple patient coordinators and the patient maybe not always see that same patient coordinator when they come in for their procedure? Sure.
Well, the first good thing that I think would be a benefit is the fact that I am the only patient coordinator there. Dr. G mentioned a little bit about, what that process looks like. I'm usually the one that takes or initiates the first contact with the patients. And, even before those patients actually come in, before we even schedule the consultation, we have this really long, girlfriend-like chat on just breaking the ice, usually initiated by the patient, which is great. At which point we will book their surgery. They come in, they've now talked to me, they're feeling a little bit more comfortable coming into the practice, and there's a lot more connection between myself and the rest of the team.
So tell me, what is your passion about meeting a patient for the very first time?
My biggest passion for me, I have to say, and I can say this with a lot of spunk too, is that for me, it's like going through the surgery all over again. Because I know how excited I was. I know how scared I was. Right. I know how guilty I felt for doing it. So the passion for me is to be there for these people that really are going through the same things that I went through. Right. And that is very satisfying for me to be there for them.
Well, I have to share with you, I had a very similar experience. When I had my very first surgery, breast augmentation, I never told my parents until the night before I went in because I didn't want to give them the opportunity to talk me out of it.
Exactly.
And I went through all that guilt as well, and I was 20 years old years ago.
Yeah.
And so here you and I both are sitting here with that same experience. There's thousands of women out there feeling that same way, and your practice and meeting with you is a safe place for them to land and for you to be able to say, I understand exactly what you're going through.
Exactly, and I think that's another thing that makes us a differentiator. I am not a behind-the-desk girl. I am not comfortable sitting behind a desk.
You want to be shaking hands and hugging people. And
Oh yeah, I mean, I consider myself a very, bubbly, flamboyant, yet professional. Charismatic. I try to be charismatic with our patients. And one thing that I think is a differentiator in our practice is, A, I don't do that because I don't feel comfortable.
Right.
And B, I don't think the customer or the patient feels that way. Mm-hmm. So our setup is a little different. We have a love seat. Mm. The patient sits on the love seat, and I sit next to the patient on the love seat. There's a lot more, and sometimes it's really funny because the patient almost, wow, that's really nice. Instead of them sitting behind the desk, you're sitting there with them.
It's not so formal. It's a little bit more inviting and more comforting.
Exactly.
Welcoming.
It really is. And what's really interesting, their body language changes. Mm-hmm. And then you actually start seeing them kind of moving even closer to you because all of a sudden, it's kind of a girlfriend talk.
Right.
So.
And they want to see what you're talking about and what you're doing, and you can do it together instead of by yourself individually and over the counter.
Yeah, and walking through the prices.
Right.
Anyone can do that.
So let's talk about what are the psychological aspects of a patient coming in for a procedure?
There is a lot of that, and that to me has been a huge learning experience from a medical industry perspective. I know I had to deal with it in many different countries, East Africa being one of them, in dealing with people and change. But we see a lot of different patients, guilt being one of those feelings that people have is one thing. People that have just gone through a divorce is another, who you have to really be able to filter out, are they here for the right reasons? Are they here because, their husband had an affair and they don't feel attractive all of a sudden? We've had patients that we brought in and actually had to deny because they were too overweight for us to be able to do anything for them surgically. So we have these patients then I meet with after their consult who break down and cry or are very emotional in my office because they then realize right then and there that there is no quick fix to lose that weight. So part of what I try to do is, first of all, I empathize with them. And everyone in our office actually has a bracelet called Compassionate. And basically what we do is in our office we have to show compassion. And every time we show compassion, we flip it over to our wife. So we know and we remind ourselves, who we're dealing with and why we're dealing with them.
Awesome.
So, and the other things, we don't just send them away and say, come back once you've lost 30 pounds. I keep in touch with them.
That's great.
I'll recommend trainers.
Awesome.
I'll send them, great recipes that would help them, for people on the go that, need some kind of, assistance on it, so that you're there guiding them through this process the whole time.
That's exactly what I was just going to say. You're just helping and walking with them through the process to get to their end result so that you can help them see that. And that's where the heart is so warmed, and your position, I'm sure, is being able to see someone all the way through.
Exactly.
That's awesome. So with that said, what should a patient be looking for in regards to looking for a really great trait in a patient coordinator? Because the patient coordinator is the first person the patient sees when they walk in the door and the last person they see after the doctor has worked their magic.
Mm-hmm. And I think that's very important. Again, it's very similar to when a patient spends their time with a doctor or the surgeon. If a surgeon spends 10 minutes or 15 minutes with their patients, you're really not going to get a great impression in terms of who and what, their capabilities are. And I truly believe the same thing is with women. I mean, there's a great book that I just recently read. I think the author's name is Bridget Brennan. It's a book called Why She Buys. And it's all based around emotions and what it is that we need to do as people that are trying to provide a service to these people. So it's spending the time with them, you know, and I'm not talking 10 or 15 minutes. Sometimes it can take up to an hour. So a patient's visit can, you know, technically take up to 2.5 to 3 hours while they're in our office. And not because, you know, we're there keeping them there. We know their time is valuable. But because we're there to hear about their stories, their weddings coming up, you know, a recent, you know, death in their family, we're there for them. We're there, and we play a very integral role into their lives.
Right. You know, and I think some patients may not realize that there are patient coordinators out there and practices that believe in this philosophy of how to treat a patient and how to hold their hand all the way through. And I think it's critical that they know that, because there are so many fears that come with the decision of having surgery. The last thing they need to be dealing with is a practice that's cold or maybe just flushes them through like a mill and doesn't really care.
Exactly. I mean, case in point, we've had situations, we do charge for consultations. I think that's extremely important for viewers to understand why. It's not that we're money-hungry practice looking to take $50, but it's the surgeon's time that he takes. He doesn't do the 10-minute consultations. He takes 1 hour to 1.5 hours of his time that he could be doing something else or having a surgical procedure with another patient that he's doing. It's valuable time. And you know what we don't realize sometimes, that you know we do that with hairdressers, we do that at spas. We all have to put down our $50 deposits or whatever that may be. But what we do is, if we find that our doctor is running late, so Dr. G is running late in his schedule, if the patient has been sitting there and waiting for more than 15 minutes, we will give them their consultation feedback. We will refund that money to them because that's how valuable we know that their time is.
Right. Okay, let's roll into patients coming in and asking questions. So many women and men, I believe, when they go in for a consultation, they're worried they're going to ask a stupid question. And how does a patient need to recognize that there are no stupid questions, that every question is warranted?
Well, actually, I've kind of picked up on a technique. Most of the patients that I've seen all have very consistent questions that they will ask. It's very repetitive. Some patients will ask it, some won't. So what I do now is I actually provide them with answers so that they don't have to ask me the questions. And I usually, the answers that I give them are usually focused around my own experience.
Yes.
And I put them in a very comical manner, because already people are already nervous about being there. You know, they just need someone to break the ice somehow for them.
Right.
So a lady coming in for breast augmentation, for example, you know, I'll tell them the story about, you know, when I first got mine done. You know, the first thing I wanted to do was run topless downtown San Diego and just show off, you know. And I said, you guarantee when you have yours done, you'll feel the same way. And guess what? They come back on their post-op and I had that feeling. Or, you know, the ladies who have the tummy tucks, and, you know, I have to tell them about, you know, different tips and tricks. You know, Dr. G talked a little bit about the compression garments.
Right.
And, you know, they have a tiny little opening there to, you know, to urinate.
Right.
And, you know, I don't know about you, but you can't really kind of direct it right out without getting it on these garments.
Girls, not boys.
For boys, it would be completely different. So I've come up with this little technique that actually worked for me, which I tell my patients now too, is go out and buy yourself a funnel.
Oh, great idea.
Cooking funnel.
What a great idea.
Stick it underneath that crazy little hole.
That is a great patient coordinator right there. That is a huge plus for somebody. I'm serious.
Oh,
if you're
I love
going
it.
through liposuction and have that garment on and you can't take it off, and
you got to
holy
go.
smokes, that's a great idea.
I still haven't found a trick yet for the bowel movement.
Nothing with the back end yet, but be working on that.
Yeah, exactly.
Oh, that's great. That's great. So, Ava, let's talk about How do you want your patients to feel when they leave your practice for the very first time?
I want them to feel like they are now part of our team. They're part of family. And I know this sounds really cliche because most people would probably answer that question in that way. But for me, it's different. When I say, like family, I mean not your, second or third cousin that you see them and you never talk to them again for 3 or 4 months. Right. I have stayed in contact. Patients contact me a year later with developments in their lives, asking me to go out for drinks or, inviting us to showers or baby showers or weddings. Actually, we've been invited to weddings. That's the way I want them to feel, is really truly with the true meaning behind as part of the family.
Well, I have to share that I believe that, because since the moment that I've met you, and it was just a fluky type thing, right? You have been so inviting, and the relationship is so open, and it is like a family relationship. And so I know that you have that in you because I've experienced it myself.
Well, I appreciate that, Sheila. I mean, that's the whole point, is making people feel that comfortable.